Hi there, okay. Dr. Sandhu here from Bedford Chiropractic Clinic. I have lovely Irene with me today. And I want to, as we were going through the treatment, Irene is really keen on exercise. How does exercise make you feel?
It's really good for my mental health.
Absolutely.
It gets me out of the house. It gets me away from my laptop. And it's a good way to push myself, and I feel really good when I get through an exercise or a class.
Absolutely. Really, really good reasons for why I absolutely recommend exercise, and I think exercise is so, so important for so many things, so many things. But the problem is when a patient exercises through pain, exercises when the body hasn't quite healed through the treatment process that we're going through. And one of the things that we found today was there was a lot of tenderness around your hip and around your hip joint, which obviously is you don't notice when the adrenaline of the exercise
and you just think
you
just think it's the exercise and that it should be targeting that muscle, so that pain is because of the exercise. You don't realize, I don't realize, I'm actually exacerbating the situation.
Exactly. And I think it's a problem when you have to wake up in the night and have to take some ibuprofen.
100%. That is a red flag.
Absolutely. But what did you do 2 days afterwards? Another class.
Yes, I did. The next day. Actually, today. I just did a class today.
Right. Okay.
Of course I did.
Right. Of course. So the message I want to get through to you is that exercise is great, but you must listen to your body.
Correct.
So what we've done is we've treated you. How does it feel now?
Oh, it's all warm and tingly, and
Great.
it feels nice.
Feels nice.
Yeah.
Great. So your gauge is going to be that you are going to poke really hard, right?
In my spots.
In your spots that we found today.
Yeah.
And if they are painful, what are you going to do?
Not do the class.
Not do the class.
No.
But you're still going to do the walking. You're
Yes,
still going
maybe
to do
some swimming.
Absolutely.
Yeah.
All the gentle things. So you're still getting the movement in your body, still getting a little bit of exercise, but you're not aggravating it.
Correct.
Until
we're healed, and then we
it.
can go back to classes.
Definitely.
That's the
And
plan.
you're going to get much more benefit out of the classes, and your body's going to progress forward, you're going to get stronger, and you're going to get much better.
Sounds
Fantastic.
good.
Great.
Alrighty.
So guys, Irene's got it. Hopefully you've got it too. The idea is exercise is important. Please exercise, but get yourself checked first. Make sure that if your body is hurting, that you're not making it worse, because invariably if it's hurting, you will be. So if you really want a good check out, if you want to find out what's going on, what's actually causing your problems, and you want to be able to exercise without any pain, then Bedford Chiropractic Clinic, look no further. Follow us on all our social media platforms. Check out all our YouTube videos, lots of educational videos with some incredible patients like Irene, just giving their side of their experiences. And I look forward to seeing you and helping you. Thank you, my darling.
Thanks.